Vaccination today was already trial in Europe. Over 40 million doses injected into 40 million European citizens. 40 showed up with some symptoms, but the rest living through with COVID vaccine. In Australia today, as I speak, about 500,000 have injected them already with this vaccine. In fact, I got many friends in Australia who text me up, Mr. Prime Minister, we've taken a vaccine and we're going through with it okay. This is not something that is designed in a lab somewhere to put off certain section of our population. Our country is totally exposed to already having weak health system. We don't have enough hospital beds. The ICU capacity is very weak. We're now in the process of getting best vaccines available on market, including this present AstraZeneca vaccine that I've got myself inoculated with. So, first one inoculated. I'll update the country in possible side effects tomorrow and onwards for the country to be assured. I'll make this a media occasion so that the country can be comforted. And you can take vaccine. But we're not enforcing on anyone. We plan to force him to kiss vaccine. Me sorry to plenty of health workers me. Also me talk person like Dr. Glenn Moller, he had to leave PNG to go to Keynes to get himself inoculated with the same vaccine that me kissing Moller. So if we had it here, he would not have been in Keynes. And we don't want to lose many health workers who are still exposed to COVID-19 every time as they save our country, attending to those who are sick. And so vaccine and we kiss him now, and we will make not just 8,000, but we are on the lookout to bring in more vaccines inside into our country. Thankfully, let me place on record my appreciation to the Australian government. That's also given indication that they will purchase over 1 million doses for us and also be shipped. And they're using the network. Papua New Guinea government through the request we placed to WHO, locating more vaccine has been delayed a little bit, but Australia is also going out to do its absolute best to procure vaccines for us and bring in country, put on shelf for those who want to take in vaccines. And me just signal in country. I know many of citizens and commentators have your views. As Professor Vince did counsel us last week Friday when we talked on the vaccine, Facebook is not a place where you source accurate information. Facebook is full of people's opinion. Their literature and their data. For you journalists, please get out there. Look into established literatures and data available on what vaccines can do and what is being done globally. And for us, Papua New Guinea, we are beneficial to research already conducted elsewhere. To research established based on best evidence available. We've collected this vaccine into our country to start off the process of vaccination. Vaccination is one arm of our fight against COVID-19. We will be deploying very strong approach in the non-clinical measures, and that involves isolation strategy. This morning I had a meeting with some governors were in the provinces, and we're asking provincial governments to take serious effort in partnering our PHAs for non-clinical measures as well as clinical measures, meaning those who have contacted COVID-19, how we should address them in isolation, address them in normal care as well as ICU care. And this is a work we will be doing. I'm using COVID-19 exposure to the vulnerability of our health system to mobilize internal support through our own budget allocations for 2021, as well as additional help from our friends abroad, including Australia, the United Nations family of organizations, WHO, to ensure into the future our health system is pandemic ready or endemic ready in the instance of such outbreaks that will happen as we live on into the future. So we don't have to be fearful. Every community is encouraged to take ownership of our response to fighting COVID. If you do not need to move around, first thing and foremost, you will not get COVID if you're not exposed. The danger about COVID is this is the most potent virus we have at this moment in terms of ease of transmission. That is the reason why we have to defend it. Unlike TB and others, COVID-19 is easily transmitted through contact. And that is why, because of its potency, we have to have a strict possibility of non-movement, policing of non-movement all over the place. Only essential travelers will be asked to travel from place to place, town to town, province to province. And we'll step up on our clinical measures to address those who contract COVID. Hopefully in time, through combination of vaccination, we could flat out what is now escalating into a peak evidence of COVID-19 transmission increase in our country. Thank you very much. I've burned 15 minutes of my time. I'm supposed to be rested as advised by doctors. So please cover them. As you see on the other side, we got the Health Secretary and Professor Wins. We have certain seniors like Sam Moyave, Sedadi Toka, and others who are now taking vaccinations. Part of this process also, we will build up capacity with our local health department, and they partnering us, rolling out this. At the moment, ISOS is an international medical company. Australia government has engaged them to assist and work with us, and our health department will interface and roll this out in partnership with the current protocol we have in place.
Prime Minister, what's your general feeling after being vaccinated?
I'm feeling okay, but different person has different range of tolerance. Not everybody is same as me. I'm naturally blessed with strong immunity, and so I'm able to stand up. I'm 50 now, going 50. So I'm in a population range that you can tolerate this sort of thing. But as I said, every human being is different. I'm no medical scientist to expand on this, but we all have our different range of propensity to handle inoculations or handle vaccinations or handle medical care. So for me, I'm a little bit okay, but I've been advised by doctors this vaccine does have immediate dizziness effect. You need to be rested 15 minutes before you will be active again, as well as different, depending on your own natural immunity and if you have underlying symptoms. The reason why there's a rigorous process is that doctors need to check you out first. If you have some underlying symptoms, if you are allergic to vaccinations, etc., then they will have different processes established to take care of those candidates who have been vaccinated. But I'm okay. I'm feeling okay. A little bit dizzy, but I'm okay.